Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons from real cases we see every day. Behind every symptom is a real story, and today's topic comes from one we recently encountered, more common than many realize. That is why we approach it from four angles: what the doctor evaluates, what the nurse observes, what the pharmacist safeguards, and what the dietitian corrects. This is the dietitian's perspective. There's a way headache problems often present. It comes on, you take something, it settles, life moves on. But then it returns. And we explain it away, it's just stress, maybe it's the weather, just take something for it. But over time, it changes, more frequent, more intense, and it stops feeling random. That is where the explanation is no longer complete, because from a nutrition standpoint, these headaches are often not isolated. They are system signals, signals of fluid imbalance, excess sodium, and unstable blood pressure patterns. When this system is stable, symptoms settle. When it is not, they repeat. Now look at the real pattern. Salt added during cooking, extra salt at the table, frequent seasoning cubes, processed and packaged foods. Individually, small, together, significant. A hidden sodium loading. And over time, that load shifts the system. Fluid is retained, blood volume increases, pressure rises, and the body begins to signal, often as headaches. So the first step is awareness, not just how much salt you add, but where it is coming from, because most of it is already in the food. So control does not mean removing flavor, it means restructuring it. Reduce added salt, limit seasoning cubes, use garlic, ginger, herbs, natural spices, then observe. If headaches reduce, if blood pressure improves, the system is responding. Now step into balance, because reduction alone is not enough. The body needs support. Potassium helps offset sodium. Magnesium supports vessel relaxation. So include fruits like banana and oranges, vegetables like cantomere, cabbage, carrots, legumes, nuts, seeds, fish, and other lean proteins. Because this is not just restriction, it is replacement. Now look at what worsens the system quietly. Sugary drinks, highly processed foods, frequent fried meals. They increase metabolic strain and make control harder. So the pattern becomes clear. Diet affects fluid balance. Fluid balance affects pressure. Pressure drives symptoms. And the cycle repeats. Now bring in structure. Home-cooked meals, measured seasoning, consistent eating patterns, and one often missed layer: hydration. Low water intake worsens both headaches and pressure control. So support the system with regular water intake. Now step back. This is not just about headaches. When you adjust your diet, you are not just treating pain, you are restoring balance. And over time, that means fewer headaches, better pressure control, lower long-term risk. Final point. Not all headaches are just stress. When they repeat, they are signals. And relief is not the same as control. So do not stop at treating the pain. Support the system behind it. When to act: if you have frequent headaches, dizziness, or high blood pressure, do not ignore it. Early dietary changes, combined with proper care, can prevent serious complications. Speak to your healthcare provider for proper evaluation, or call/WhatsApp +233 208 720347. And remember to watch the other 3 videos from the doctors, nurses, and pharmacists. Each perspective completes the picture.